Thank you so much to all of you, because I know it's rather crappy outside. So thank you for coming. And I have to say, I'm encouraged to see at least some men in the room. Often when we talk about gender-based violence, and it's usually just women in the room. And I think that's part of the problem. I think we need to have men engaged in order to just even begin to try and tackle the problem. So let me start with a little bit of background. I'm going to talk mostly just about India, which is where I work. And currently I'm actually working on a research report for Human Rights Watch on sexual violence against women in India and trying to figure out challenges that they have to access to justice. So how does the criminal justice system actually respond to a survivor of rape or sexual assault in India? That's the work I'm currently doing. I'll talk a little bit about our methodology as we go on, or maybe you can ask when you have question and answer. So in India, just numbers, according to the National Crimes Records Bureau, which is the institution that actually collects numbers from various police stations across the country on crimes of under certain categories, there has been an 89% increase in the reported cases of rape in 2015, over a decade. The numbers reported for the year 2015 was 34,651 cases of rape, which roughly comes to about 94 cases of rape reported every day in India. This probably wouldn't say that very much, considering we actually see very high numbers reported, even in countries around the world where we would think that the criminal justice system would respond better. US, Canada, even Australia is reading actually has pretty high reported cases of rape. The challenge is that in India we think these numbers are very underreported even now. Even though we've seen a steady increase in the number of rape cases reported and sexual assault cases reported, we still believe that these don't tell you the full story. These are still underreported. And that's because there are still a number of barriers to reporting rape. Now, the question I get asked very often by journalists in India is, when they see these numbers, is, so are there more rapes happening in India? And this is particularly a question you get asked a lot because of, this issue getting, sort of the global spotlight after a particularly brutal case that was reported in December 2012 of a young medical student who was raped on a bus and then sustained injuries that led to her death a few days later, and which actually began this whole change in our laws, in our guidelines, in how the government even responded to this issue soon after. And we'll talk a little bit about that soon. But considering that because of that, there was more awareness, and even the laws changed to now actually make it criminal for a police officer who refuses to actually register a complaint of rape, which wasn't the case earlier. But now if someone goes to register a case of sexual violence against them and the police officer refuses to do so, the police officer themselves can go to prison for 2 years. And one of the reasons we think that might be the case, that there is fear, there is more report out. There is just more awareness and more women may be reporting. So it's difficult to answer if more rapes are happening or more rapes are getting reported. But we do know that more rapes are getting reported than ever before, and that's a good thing. And yet we feel these numbers are still underreported. Going back to, I was just giving you this December 2012, this particular case, and the media gave this girl, the name of Braveheart, and many of you may know this case as the case of Nirbhaya, which is the Hindi name for Braveheart. Right after that, for the first time we saw that this case really shook the country in a way that we've never seen before. And thousands and thousands of women and even men came out on the streets protesting against what had happened and demanding change, demanding that we have better laws in India to respond to this, and we have better laws to prevent this from happening again. And so in March, and this is quite incredible because within a period of the 3 months, We had an entire process where an entire country was actually involved in reviewing the laws we had and to make changes that were very important and very required. So in March 2013, the Indian Parliament actually made significant amendments to the current law, which I will now refer to as Criminal Law Amendment 2013, CLA 2013. Some significant things that were changed was, the most important, the definition of rape itself was expanded to go beyond just penile-vaginal penetration. So even non-penetrative assault could now be rape. More new categories of offenses were added. Acid attacks. Acid attacks wasn't a specific offense under sexual assault before this. So that was added to our laws. We had stalking, voyeurism. So several of these offenses were added. Also, the law provided for free and immediate medical treatment for survivors of sexual assault, as well as for acid attack victims. The law also laid down, as I mentioned, penalties for police and also penalties for health professionals if they refuse to actually give the required care to the survivors. This included health professionals in private hospitals. So the idea behind all of this was to keep the survivor of sexual assault, the woman, at the center, and then make sure that the criminal justice system responds to the needs and requirements of her. And in many ways, take away one of the biggest barriers to reporting rape in the country, which was just how the criminal justice system responded to you. So now, 4 years later, one of the things I'm trying to do is to see, has India been successful in actually making sure that the criminal justice system responds to survivors better? Barriers to reporting rape, and unfortunately we find that they still exist. One top one would be stigma and victim blaming. This probably is not news to even those of you sitting in Australia, and I see this when I read reports in The Guardian or in the New York Times about what's happening in the US or even UK, right? We have victim blaming as one of the biggest sort of barriers to women wanting to go and talk about, like breaking the silence. That's a big issue. So it's still questions like, what were you wearing? Who were you with? What were you doing so late at night? Did you drink alcohol? There are all these questions that have nothing to do with the actual crime, but really are meant to raise questions on women's character. That still happens. We constantly see, even though we thought that after the parliament changed this, there would be, at least in the mindsets of the political officials, elected officials, we will see some change. Unfortunately, we still see them making extremely derogatory remarks when issues of sexual assault against women happen and others. So we've had godmen who are very popular in India these days. We've had one godman say that perhaps you should just try to, if you call them brother, bhaiya, it's the Hindi word. So if you try and appeal to their sense of empathy, they may not rape you. So that's one way to avoid it. Chow mein, eating all this Western food, chow mein was another thing that someone said was leading to more rapes in the country. Mobile phones, really bad. They spoil the character of the girls, they bring bad thoughts to your minds, and therefore maybe avoid mobile phones. Of course, jeans in colleges, not very good. So there are a host of things that we can probably do according to many of these people. What I mean to say, I know it sounds really ridiculous when you say that, but when you have elected officials or people in power or people who have great influence over public minds in India say things like this, it just goes to show that you still have very similar mindsets, and they continue to be reinforced on woman being, it's her fault. And maybe if we have some time, I'll show you this great video campaign that some of India's, including one famous actor from the industry, actually did this campaign on "It's Her Fault," just to show that. And while it sounds ridiculous, that it's true. I don't know how many of you saw. I think BBC did this video recently, where they showed that a man who had been mugged, this was set in, I think, the UK, there was a man who was mugged and he shows up to report the crime that he was mugged last night, and there is a woman police officer, and he's wearing like a business suit, and the woman police officer asks him, "So why are you wearing that last night when this incident happened?" And, "Oh, so you were flaunting your wealth." And so there were all of these questions, and then another female, I don't know, have you guys seen that video? I urge you to see that video, because I mean, it's hilarious. Unfortunately, it's tragic. What it tries to do is tries to show you the kind of questions that get asked from someone who's trying to report a crime, and they just turn the tables of what happens if if it's a man. Worse, women face it all the time, but just try and turn the tables and see what happens. India still doesn't have a victim or a witness protection law, and that's a huge deterrent as well. So what happens is, often we find when, during rape trials, either witnesses turn hostile or even survivors sort of withdraw. And that's because there's a lot of intimidation, obviously, from the families of the accused many times, because many times they might come from the same neighborhoods, villages, even families. And so there's a lot of pressure, intimidation. This can get worse if you bring in the issue of, say, caste, for example. So as you know, India has the social system, there is this hierarchy. So if the survivor is from, say, a lower caste, say the lowest caste among what is considered among Hindus, say a Dalit woman, and if she alleges rape by someone of a higher caste, often you will find that even the police, or definitely the villagers, would put pressure on the woman and her family to withdraw the case. And lack of an actual law for protection just makes them more vulnerable to this. Not having support from family is another. Often women are just afraid that even their own family members may not believe it when they actually say that this happened to them. Police attitudes and humiliation in the courts. Often, and we find this in our research even now, when women go to the police station to actually report crime, the kind of questions the police asks them, sometimes just the disbelief, the insensitivity that they would show, is a huge deterrence to women. And in urban areas, you would also have the questions of, like I just said, and this is very recently we saw this. Say, in fact, I think last month in Delhi, there is this quite a popular, area called Hoskas, which is quite hipster, and lots of young boys and girls and men and women go there. There are lots of restaurants and pubs, and so a woman reported rape while she was there one night, and even the media, when they were reporting, and this is 4 years after, please remember, there's been a huge number of civil society campaigns, media campaigns, social media awareness, government policies and campaigns that have tried to address. Despite that, in the media reportage, which obviously much of the information really comes from the police, right? That's how you know. I learned many times over, depending on how many articles I read, how many pubs she had already visited that night and how much alcohol she had to drink. Because that obviously is very relevant to what happened to her. And that's now, after we hope that there would have been change. And don't get me wrong, I will talk about, yes, there have been change in policies. Like I mentioned, the law, there have also been, India has actually, the Ministry of Health and Family Welfare established new medical legal guidelines. This is when, one of the first things after a woman reports rape or sexual assault that has to happen is they have to go to the hospital for two things. One is for care, for required health care because of what happened to her, but also for collection of forensic evidence. So now there are guidelines on what kind of evidence should be collected, how the health professionals should act with them, what they should do, what they should not do. And yet we find that this doesn't trickle down. It's a big country. So what might happen, it's a federal structure. So every state has to also issue to the hospitals, to the health professionals, to the police stations. Health is for health, for police, all of it trickles down to each of the state levels. And maybe some of the states are doing better than others. Sometimes cities might be doing better than, say, blocks or village levels, but it doesn't trickle down all through. So enforcement, we find, is a huge issue even now, despite the changes in policies, in programs, in laws, in guidelines. When I was talking about just like humiliation in courts, the cross-examination, and this I heard from someone even in, I think in Melbourne, someone was telling me that there was a case recently where, a woman had, I'm not sure if it was domestic violence or just sexual violence, and she was going through like 2 weeks of cross-examination in courts in a way that just completely, defeated her morale, and she withdrew the case. And that sounds so familiar to me with what happens in India. While, that I don't know how often it happens here, but in India, despite, again, laws talking about how consent, how consent should be read into, in such cases, we find that a woman's sexual character, whether or not there was consent, all of these questions are repeatedly asked by the defense counsel in a way that is extremely humiliating, extremely traumatizing for rape survivors, and often, as I said, either they would drop out, they would withdraw cases, or we find them actually, if the counseling has helped them, if they've actually improved in getting back to their lives, we find that it acts as a huge setback for them, the trials themselves. One of the things that is particularly problematic through the criminal justice system, we find, is during the collection of forensic evidence, health professionals in India do what in lay terms we call the two-finger test. Now this is something Human Rights Watch and others had worked on. In 2009 we had worked on it. So this is before we had better guidelines, better laws. What it means is the health professional really inserts 2 fingers in the vagina of the woman and then makes certain conclusions. And then also the same health professional or another from that hospital would testify in court. Now please understand that in India, forensic evidence is important but not essential for conviction. A woman's testimony is the most essential part, and if it's cogent, if it inspires confidence, that is enough to secure conviction. However, in reality, both police and the courts put a lot of importance on forensic evidence to, whether or not a conviction can be secured. It depends on that. So, in these cases, often what the medical professionals will put on the record or say in courts becomes pretty important. And we thought the 2-finger test now has been prohibited by the Supreme Court for if it's to infer about women's sexual history or character or any of those things. And in the medical legal guidelines that I just had mentioned, it is very, very clear that it can be done only if it is medically important, right? If you have to figure out injuries, then yes, but it shouldn't ever be used to figure out to make any comments on women's past history. And yet, in my work in the last 6 months, I have medical reports where I'm seeing inserted 2 fingers easily, woman is habituated to sexual intercourse. Again and again, these terms come up. Now again, you would ask, how is that relevant to whether or not she was raped? And that is the challenge. How do you make sure that each of these institutions, whether it's the police, whether it's the doctors, the health professionals, and then the courts. Make sure that they enforce, even if we have pretty good laws now in India on paper. How do they get enforced? And that's really the challenge. Maybe I'll end there so that we can open it up for question and answers, and some of the other issues can, we discuss them. And I have particularly, I chose one of the cases from my report to discuss, to give you a sense of like how bad things can get for some of these survivors when they actually are trying to, get justice from the system, but are discriminated at various levels. But yes.
Does anyone have any questions? I can start with my own question. So do you think the problem with sexual crimes in India, is it a judicial problem? Is it sort of like, something that needs to be tackled with the parliament, or is it a cultural problem? Where do you think it stems from?
So as I mentioned, Parliament already changed laws. So laws are not the problem, right? And procedures are not a problem because now we have some guidelines in place that, if enforced, would help. Of course, mindsets are a big part of the problem. Mindsets that we have in society, India is still a very patriarchal society. We, like I mentioned, victim blaming, stigmatization are still very much a part of what a woman endures just as they go around their daily lives. We have this innocuous term that nobody, I think, outside of South Asia even understands what I mean when I say eve teasing. Some of you may know the term, but eve teasing, really what it means, what it refers to is harassment, like sexual harassment. So on the road, you're passing by, 4 men start following you, making lewd remarks. It's eve teasing. But I would say it's sexual harassment, right? So these innocuous terms don't help anyway. Anyway, so these are troubles that, most Indian women would tell you that they, as soon as they step out of their homes, that they encounter. Domestic violence, marital rape is still not an offense in India. That's a challenge. So yes, mindsets are an issue. Education is very important. That's why right at the outset I had said that engagement of men is as important in this issue, and we've seen some of that happening in the last 4 years. That there are these campaigns, where men are involved to talk about, say, no means no, or men against sexual violence, and so you have some of this, but we have a long way to go in India to actually making sure. So I think the first step it has to go parallelly. I think that you deal with making sure that from education in schools and education at every institution and training and sensitivity, gender training, that has to happen, but then the laws have to be enforced as well. Because if that doesn't happen, it doesn't act as deterrence of any kind.
Thanks, Jayshree. That's really interesting. I'm wondering, just from the point of view of advocates, is there any differentiation in the way you approach this issue in the urban areas, in particular, compared to the majority peri-urban and rural areas?
So, I actually, in much of my research now, I have a lot of cases that I'm looking at from rural areas and villages. So I'm working with some of the groups that are helping, getting legal help for survivors there. One of the things that I found, and this goes to how the government needs to think of this more comprehensively, that I don't think they're doing yet, is how the woman even gets to, how she even tries to access services, whether it's how she gets to the police station, to actual hospital, to the courts. What I mean by that is, one of the things that we're trying to do, and this, as something that, this is a model that India is learning obviously from other countries, and if it's implemented well, hopefully it would make a huge difference, is these one-stop rape crisis centers. So the idea being that instead of a woman who's already suffered, making sure that she goes to the police station, runs from there to one hospital. Often we've seen that they go from hospital to hospital to get services and to get, because they wouldn't help them, and then courts are just such a huge maze to most of us, so you can imagine it really is, it's a space that we feel very confused and, like I mentioned, re-traumatized in. So the idea of the one-stop crisis centers is that you offer all of these services to them in one place and in a manner that is helpful to them. It is to make sure that there is legal counseling, but there is a lot of psychosocial counseling as well, something that we've just not seen happening. And there is support services for them throughout, whatever they might need. If it is a shelter they need, or if it is, actual medical care that they require, or if they require psychosocial counseling over a period of time, pro bono legal aid, all of those things. In the context, so the way, say, the government is thinking about it is putting it in a hospital. Now you will see it in maybe in a hospital in the capital city of a state. Now what happens when a woman in a village wants to report? I mean, the nearest police station sometimes might be half an hour and an hour away. And there was a case where I remember, the husband and wife told me that it was the monsoon and they didn't have a vehicle, and they were like, we had to wait for about 24 to 48 hours to even make it to the police station, which is a critical period in order to actually get evidence, medical evidence, right, that they lose. Then from there, often the police will take them to a hospital and would dictate how the whole process works. Whereas at least in urban areas, while it may not work perfectly, there might be option for the woman to go to the hospital straight instead of a police station, right? So I mean, just the access to services completely breaks down as you go more and more remote, and that's not how they're thinking about it. Unfortunately, so much of the I feel so much of the focus is on infrastructure, in like building where, okay, in a hospital we need to have this, what should it look like, how many square meters, rather than thinking of services, and rather than thinking of, are we getting to them or are they coming to us? And if they're coming to us, if they are in remote areas, how are they reaching us, right? Us being the services. So I think that is something that we really need to think more creatively about in India, in how are we, if we are saying that we are keeping women at the center of this, and this is to make sure that the criminal justice system responds to them in a way that is conducive and helpful to them, then we need to think about it, I think, more creatively than we are doing now, in more nuanced ways. How can we use technology? How can we use other things in order to make sure that the services reach them in a way that works for them, and not in the way that works for the state?
Thanks, Jayshree. You mentioned that some states are more effective in implementing the laws than others. Have you noticed a reason why some states might be?
That's always the case in India, that, because it's such a huge country, and different states have always had different level of development indicators, how the state, the size of the states are different, the levels of literacy, education, all of the gender indicators are different in states. And also how some states may perceive certain issues over others, how the law and order in many states might be different than others. So it's any issue you pick up, it'll never be quite the same in how each state responds. Unfortunately, you almost always knows which other states who will respond better than others, because maybe where you start at itself is different in many states, right? The level that you are beginning to tackle the problem at is different in many states. So yes, and again, police structures in different states are already operating differently in some ways. So you will find that obviously then they will react in places where they've been sensitive generally speaking, then they will behave perhaps better when dealing with this as well. Similarly, with the healthcare system, if certain states have better healthcare throughout the state, then that means that the survivor has a better opportunity of getting required healthcare in a way that works for her versus another state where there won't even be a healthcare facility anywhere close to her. So that's always been a challenge. But generally speaking, you know, in the way the institutions respond, we have seen the lacunae, regardless. It just is a question of, yes, some will respond better than others, but I think there is space for improvement perhaps across the country.
So I've read that only about 10% of rape cases get reported, and then of all rape cases, only about 3 get result in a conviction. What do you know the figures that in India, and have they improved in the last couple of years?
So I'm not sure about, I do know that the rape cases in India are underreported, and this is something you will hear from everyone. Now exactly what percentage of the cases are getting reported, that number is not available to us, unfortunately, because people who do not report, how do you know what is that number? There has been an increase, which, like I mentioned, it could be either more. It's hard to know whether more rapes are happening or whether and conviction rates are low in India as they are around the world. And at least in India, some of the things that I mentioned regarding, you know, if there is a better victim and witness protection law, if there are fewer barriers to reporting rape, if we are able to have a more improved, sensitized criminal justice system, then we might see changes in that as well.
Yeah, so you mentioned that, you know, the social stratification system makes things very difficult, and you spoke of a Dalit woman. In my experience, I've noticed that the social elite in the country are more repressive when it comes to things like this. Do you know if what are the trends for their reporting, like the so-called upper caste? Do they report more or lesser, or I think that data wouldn't
No,
even
we
exist.
don't have data that is that sort of disaggregated data, obviously isn't there by. But I think one thing that we've seen, we've done a lot of work on child sexual abuse as well as domestic violence, and there was always this preconceived notion in the minds of Indians, perhaps in other places as well, that this is a problem that happens with poorer sections of society. And that myth has definitely been broken in India, that this is not just a problem with poorer, uneducated, marginalized sections of society. No. What happens is, as you mentioned, in a lot of better educated and wealthier sections, the taboo might be even more in order to not report, especially if, say, it's a family member that's a perpetrator. So that is something, yeah, so that myth I definitely think has been broken, but in terms of where it happens more, that sort of data is just not available.
And you also spoke of God men and Eve teasing. I just thought it's relevant to ask you what your views are on the anti-Romeo squads that Yogi Adityanath is just, rolled out.
Right. So what he's referring to is India has a new chief minister in the largest and most populated state in the country, Uttar Pradesh, 210 million people, and his name is Adityanath. He goes by Yogi Adityanath because he's a Hindu cleric. Since he came to power, one of the things he had campaigned on is for the protection of women. He had said that we are going to have these anti-Romeo squads. Perhaps you should call them anti-Adam squads, right? Because if you are using my therapist, right? Sorry, jokes aside. So he's going to have these anti-Romeo squads who are going to be, I think, patrolling colleges and sort of where, you have young, more women to make sure that, these men who are just like hanging on and going to trouble them, stalking them, whatever, to stop that. to make sure that, women are better protected. Now, I have a little bit of a problem with this whole protection thing, right? I mean, what can go wrong, really? So, in that sense, I have to say that principle sounds problematic. Like, and it's just a recipe for taking the law in your hands, right? I mean, even though these are police officers, what are you doing? Are you stopping people from using public spaces? I mean, obviously that is not very helpful. And again, who will we find are the ones that they are catching, and there are already certain, we've already seen news reports emerging about the kind of harassment then young men are facing in the state from police. And police, we know in India, can be biased, even can be communal. So it's really, I mean, that is not how to tackle this problem. There are other ways to be doing this better. So that's what I would say for any. And I mean, really, I don't think women need to be protected. I think men need to be educated.
Do you think there is a correlation between pornography and rape? I mean, because most rapists, I think, I saw this video where they say that it is because they watched a video that instigated them to rape.
That's not the same as because you were wearing a short skirt. I couldn't help myself.
I don't know.
Do I need to say more?
In terms of marital rape and mindsets and those kinds of hurdles, is there does religious discourse present itself as a mighty big hurdle to change those things, like marital rape? Is it because there is a religious discourse on gender roles that dictates certain values?
So the Minister of Women and Child Development in India on marital rape said that, put it in the cultural context. So saying that this is, in Indian culture, the way marriage is seen as different than, say, in Western cultures. So it has been put in the cultural context many times, and I mean, that's just a travesty, really, because India is part of CEDAW, the Convention on Elimination of Discrimination Against Women, which has repeatedly told India to make marital rape an offense, but more importantly, after the 2012 case, the government had formed a commission called under a retired Supreme Court Justice called the Justice Verma Commission. This was a 3-member commission, and this was tasked with the review of all laws and to recommend the changes. And this really was the, it was central piece to then what we saw the changes in laws. And this is when I meant the entire country sent in recommendations and reviews. So 70,000 sort of submissions were made to the commission in terms of what needs to change, from civil society groups, individuals, activists, doctors, everybody, right? And one of the recommendations of that commission, which unfortunately the government overlooked when it was reviewing the laws, was that marital rape should be an offense. And this whole justification, of why, the rape within a marriage should not be an offense cannot stand. So that was one. What we do have is loosely, we have a limited sort of a definition where if a couple has been separated for 2 years, not divorced, but separated for 2 years, then yes, rape does, then it is rape if the woman says so. So we do have a limited definition of marital rape, but I mean that's definitely not sufficient.
Right. Is that because there is a religious...
There is resistance. There is resistance. I mean, really, anybody can say any sort of justification. I said that we've heard the cultural justification quite a lot in India about, and that goes to gender roles, right? So yes, anyone can justify on any grounds, but we've had even government-appointed commissions say that it should be an offense. So I guess at some point, when India reviews laws again, we might But for now, there is a lot of resistance to that. And that will tell you something about, again, what I keep going back to, patriarchal mindset, right?
I have one question for you. So what role does the access to your bathrooms play for those sort of rural women who are victim to sexual violence?
That's actually an interesting question. And surprisingly, it came up in a couple of my cases that the women said that they were raped when they had, these were women in villages who had gone out very early morning or late in the evening to defecate or to call up nature. So to put it in context for those of you who may not know the background, open defecation is a huge problem in India. Access to toilets is a huge problem in India. In large swaths of rural areas, women do not have, obviously people do not have access to toilets, which make women vulnerable to sexual violence as well when they head out early mornings or late at night. And one of the things that the previous government, but also this government, has particularly focused on is to build more toilets as part of what it's called its Swachh Bharat Abhiyan, which is Clean India campaign. So building of toilets is something that, for the last 5 or 6 years, and we've seen some of the UN agencies being focused on this as well. So this has been a campaign in India. Build more toilets, make sure, and not from a variety of perspectives. There's a WHO report that also talks about how it stunts children's growth, open defecation. So, from a variety of perspectives, this is a good idea. In terms of, to answer your question, yes, not having access to toilets is one of the reasons that we have seen sexual violence. Definitely makes them more vulnerable to violence. Building of toilets will be a very good idea, but having water in them would be a better idea, so that they can be used. And that is something we're not sure, like how many of these toilets that are being built are actually usable. So it would be good to have an account of what's going on with the building and the actual usage of these toilets. But it's a step in obviously the right direction. And we need to work on this more. We're nowhere close to where India needs